the gentleman from Georgia, Mr. Carter, and followed by the patient gentlewoman from Washington State, Ms. McMorris Rogers. So first, the gentleman from Georgia.
Thank you, Madam Chair. Thank all of you for being here. I know it's been a long day, and you're almost there, so hang in there, okay? Certainly important things we're talking about. There's no question about that. Mr. Germano, I wanted to ask you, do you happen to know how many health profession shortage areas there are in this country, or any idea? Or?
I don't, but there's a lot.
There's a lot. Most of them in rural areas, I would assume, as opposed to urban, but I suspect we'd be surprised to find them in urban areas as well.
I think there's quite a few in urban areas as well.
Right, right. Earlier, one of my colleagues asked you about dental health, and that's certainly important. First of all, again, I'm from Georgia, and remember, there are two Georgias. There's Atlanta and there's everywhere else. And it's true, and I represent South Georgia. We got a lot of rural areas in South Georgia, a lot of healthcare needs. Accessibility to healthcare is a big concern of ours and a big challenge, and particularly oral healthcare as well. And I was just wondering if you could reiterate what you said earlier about oral healthcare and how important it is, particularly in our most needy areas like that.
Well, we know that oral health disease is not just a cosmetic thing. It has the underlayment of causes other problems. Women who are pregnant with oral health disease can have bad outcomes with their babies, for example. We know that we can prevent a lot of this. It's not just having a dental office. We've embedded dental hygienists in our pediatric practices now, where they're going in after the visit in many cases, and they're doing a little education and they're painting the teeth of children. So to try to prevent cavities and other problems, and educating as well. Oral health disease, number one pediatric disease in America is oral health disease.
Right.
And it's preventable. That's the thing. A lot of oral health disease is preventable.
You know, we talk a lot about making sure we have, and with good reason, making sure we have doctors in underserved areas. But there are other healthcare professionals that we need to concentrate on also, such as dentists.
Yes. Any
others that you can think of that really propose a glaring void there, healthcare professionals that we just...
Well, I would love to see the role of pharmacists be more...
Thank you very much. Oh, did I mention that I'm currently the only pharmacist serving in Congress?
That was a good answer.
It was a good answer.
I do think there's a role for... the problem is in the FQHC world, pharmacists are not recognized as billable providers, hence it makes it difficult to put it together. But it makes total sense. My clinicians clamor for that, that kind of direct clinical pharmacy involvement, not just on the retail side, but on the clinical side, would make a world of difference, I think.
Great, thank you for that. Let me switch now to a problem that unfortunately we're a leader of in the state of Georgia, and that's maternal mortality. And it's embarrassing for me to say that, and whereas I do question sometimes how we arrive at some of these figures, because I want to make sure we're comparing apples to apples when we talk about maternal mortality, but we cannot deny the fact that it is a problem, and particularly in the state of Georgia. And I'm just wondering, one of the challenges that we face, as I mentioned before, is just a lack of providers. And what you mentioned earlier, and you're spot on, because when I served in the Georgia State Legislature, one of the things that we discovered was that most of the physicians, as Dr. Burgess pointed out as well, most of the physicians stay where they practice, where they do their residency. And we learned that in Georgia. That's why we increased the number of residencies in our state in order to try to attract physicians and try to get them to stay. But any ideas on what we can do aside from that to increase the number of providers, particularly in the rural areas, and particularly in the way of OBGYNs, where we need this to address the situation with maternal mortality?
Well, most OBGYN training programs are in big cities, so that you're running against it right away in terms of attracting OB-GYNs to rural communities. So that's tough. But what we can do is to work with our nurse practitioners.
There you go.
Early prenatal care, getting women in the first trimester, really critical. Getting them tucked into prenatal care, and then we can help monitor and support them through their pregnancy. I think that can make a world of difference.
And scope of practice is pretty much a state issue, but at the same time, if we empower some of these other healthcare professionals, to give them the opportunity to serve. I think they can help us to achieve what we're trying to achieve here.
I agree.
Very good. Again, thank all of you. This is extremely important, and we certainly support what we're trying to do here. Question how we're going to pay for all this, but nevertheless, this is very important. And thank you, Madam Chair, and I yield back.
The gentleman yields back, and now the ever-patient